According to the National Eye Institute, millions of Americans are dealing with dry eye syndrome triggered by, we're sure you can guess, staring at phone, monitor and TV screens for hours.
Oh boy.
Yeah.
And today we have optometrist Dr. Wang to share how we can take steps to potentially reverse the impact with a high-tech treatment. Good morning.
Good morning. So dry eye disease is an epidemic. You know, I've been in practice here in Las Vegas for 25 years, one of the driest climates in the country, and we're just seeing all the kids to seniors and everybody in between with increasingly dry eyes.
Yeah.
And the dry eyes are it's a misnomer because it's really bad tears. So our tears are made up of oil, water, and mucus. And it's actually the oil glands that get increasingly clogged the more we use screens, and those glands don't unclog themselves. So we brought in a new device by N-Mode called the Envision, and what that does is it helps us melt open the oil pores that get congested from poor blinking and insufficient blinking. Normally we blink about 20 times a minute, and when we stare at electronic devices, that just completely collapses.
Yeah, talking about that, and how do actually staring at these screens really have this impact? I mean, we're all guilty of doing this throughout our day.
So it's twofold. One is whenever we concentrate and we stare at a fixed object, whether it's driving, staring at computer screens, or scrolling on your cell phone, our eye movements collapse, and the eye movement is what triggers the blink, that recovery blink. Number two, blue light actually triggers the nervous system, and that also leads to incomplete blinking.
Wow. Okay. Obviously, you brought in this incredible new technology. Is this the only way that the viewers at home or anyone who suffers from this can take steps to you know, take the discomfort, get rid of the discomfort? So
the most important part is awareness. So if you know that you're staring at screens all day, it's critical that you actively and consciously blink more. And a lot of us make incomplete blinks, where we do a partial blink and our lids don't seal all together and you think you're blinking, especially women who are wearing eyelash extensions. So it's notorious that they make poor blinks. And so actually actively blinking, feeling your bottom lid when you close your eyes, whether you're on a break or whether you're actively working or you're driving, feel that bottom lid. Number two, using warm compresses. Warm compresses do help, as well as preservative-free artificial tears. Now, these are the most commonly prescribed treatments for dry eyes symptoms. But a lot of times this is insufficient, and the reason is because these oil glands that line our lid margins, they're responsible for producing the protective oil that coats the surface of our eye. And once they get clogged, which is common in the desert, they don't unclog themselves. So we brought in a device called the Envision.
Yeah, and how does this work?
And what this does is it creates radio frequency heat that we run along the lid margins, and it raises the temperature of the glands to about 42 degrees Celsius. That melts open the oil pores, as well as tightens the skin. Lid laxity is also a part of what causes these glands to get clogged over time, because as we age, the lids don't get, they get looser, and they can't create the appositional pressure to release the oil to coat the surface of the eye.
So what kind of results have you seen from your clients who come in to take advantage of this? And, you know, is it an ongoing treatment basis because we're always staring at those kind of screens, or, you know, is there a set certain amount and duration that it needs to take effect?
So we've seen tremendous results with radio frequency from N-Mode, both in terms of melting open the oil pores, cleaning them out, as well as tightening the skin. So we do a series of 4 to 5 sessions, and that will generally last 18 to 24 months, sometimes longer. We follow that up with your standard regimen of warm compresses and artificial tears, and really awareness that you really have to blink consciously throughout the day, especially on your phone, which we're all guilty of, in order to keep those oil pores working properly.
And take a break from those screens.
And take a break from those screens.
Well, Dr. Wang, thank you so much for joining us this morning.
You're welcome. It's a pleasure.
To learn more about the work Dr. Wang does, in particular with Envision, head to centennialfamilyeyecare.com.